All right. Welcome back, students, and thank you so much, Miss Anuradha, ma'am. And this is a value-added course on applications of stem cells. And today's lecture will be pre-HCT evaluation of donors, which is this VAC is conducted by Department of Medical and Technology, UIAHS, Chandigarh University. And in the last session, ma'am was discussing about uh, evaluation of donors for donating the blood, right? Donating blood for a stem cell transplantation. And I was gone through all the lecture and it was really interesting. And ma'am was already covered almost all the topics of queries about donation. And I was really intrigued that there is no complications at all. Even I searched in ChatGPT and I haven't found any risk in donating blood for a stem cell purpose. And was really interesting. And if there is any questions regarding donation of blood, you can ask students if there are any queries. Any queries? I or else, ma'am, we can continue. Students are joining. Maybe within 10 minutes, there might be more students, so we can have conversation at that time, ma'am. We can continue with the session, ma'am.
Right.
Yes, ma'am. I'm giving you sharing rights.
Yeah.
Yes, ma'am. Yes, done, ma'am.
So, thank you all for joining again for the session. So, by the time Artha comes, let us begin with this MCQ section. So, what is the age range of the preferred HCT donors? I would specifically say for unrelated HCT donors. So, you can answer or you can type your answer in the chat box. Someone has typed the answer. Is D correct? It is D, Faith. Thank you so much, Faith. You have been participating very actively throughout the course. So under 60 is the correct age. And if it is related donor, then up to 75 years of age, donation can happen. The next question is, donors should be in good health condition. Which of the following condition is generally a disqualifying factor? Anyone? No answer? It's none of the above. Yeah, someone had answered. It's no hypertension. I mean, can be a cause of concern, but it's not we call it as it's not like contraindication for the blood stem cell donation. So, a person with hypertension and if taking medication, then depending on what salt they are taking, we advise the donors not to take any medication for hypertension during the time GCSF is being administered. And if we continuously keep monitoring the donor's blood pressure at the time of donation, and if required, we give the medication to the donor to control the blood pressure of the donor. So, hypertension is not a contraindication. Asthma, I had a very interesting case of donor. So I had a donor, young donor from 22-year-old donor from Haryana. So for him, we got the blood. It was COVID time when he was to donate his blood stem cells. So his blood tests were normal. His body imaging tests were normal. And then he reported me that I have seasonal asthma. So none of the blood tests we do particularly to ensure the pulmonary function, or we are not doing the like lung function test except for the chest X-ray. So chest X-ray was clear when we got it done, so nothing was suspected. But he then informed me that he has a seasonal asthma and he was taking certain medication. He was using pump for consuming the medication. So again, doctor recommended further investigation for asthma. He was put on medication for 1 month, and after that, again, we did the pulmonary function test at his place. Still, the doctor was not convinced. He asked him to come to CMC Ludhiana. Came to CMC Ludhiana. We repeated some tests. Doctor, both the pulmonologist and the hematologist both examined the donor properly, and upon their satisfaction, this donor was allowed to donate his blood stem cells. And so asthma is again not a contraindication. Diabetes, like not every time, but yes, if the donor is taking insulin injections, then normally we say no to the donor to donate his or her blood stem cells. So ideally, the answer should be the diabetes conditioner. Otherwise, if the donor is taking tablets for diabetes, then he or she can donate without any issue. So ideally, when uh, like this, none of these diseases are the contraindication for the donation. Next is the informed consent is critical ethical consideration. What does it involve? Anyone? Someone again? It's faith. Correct, faith. It's donors' understanding of potential risks and benefits. The next question comes is, what is the primary purpose of infectious disease screening in the donor's evaluation? No one? The correct answer is C, to detect infections that could be transmitted to the recipient, right? So again, it is C, correct, faith. And the last question for the session is, what is the goal of the donor stem cell function assessment? Correct. It's B, to ensure the donor stem cells meet the recipient needs. Now, some of the case studies, I'm stopping sharing of my screen right now, and I would like to talk to you. So, I will talk about 3 cases wherein 2 donors had high level of hemoglobin when the CBC was done. And there was another very interesting case of a donor whose platelet counts were reducing when we started administering the GCSF. So, the first case is of a 19-year-old boy. You can go and read about him on our website. His name is Sahaj Chawla. So, we had one donor for that patient. The patient was thalassomic child. So we had one donor, but for some reason the donor backed out at the last moment. So we had only one donor, which was Sahaj Chawla, 19-year-old boy. He registered at Lucknow, sorry, in a nearby place near to this Ayodhya. So in a blood donation camp. So I was the one who counseled him. So I was asked to talk to him, and I called him. He said, "Ma'am, right now I am willing to donate, but I need to talk to my parents, as well as right now I'm in Bangalore. So how shall we manage the donation and all?" And donation was super urgent, and his exams were going on. So we said, fine, we will do your physical assessment and your laboratory test at Bangalore. Then we will call you to Delhi once your exams are over. We will call your family members from Ayodhya to Delhi, and your physical examination will be done, and we will uh, go ahead with the donation process if everything is okay. So in between his exams, he took out one day. His parents luckily agreed, and he took out one day and went for the physical examination. The Dathri coordinator in Bangalore informed me that, "Ma'am, this boy has only one kidney by birth," and like we were all shocked. What we do? We were not. We never had come across such case, and we didn't know whether this donor will be able to donate or not. So I spoke to my seniors in the office. They say better follow the doctor's advice. Then the donor came to Delhi, and doctor said, "Fine. I mean, with a single kidney also, he can donate his blood stem cells if he is willing to." And the doctor examined him physically. Then nephrologist opinion was also taken. He also said that having a single kidney is not a contraindication for the donation. So definitely he can go ahead with the donation. But there was a problem. Uh, his hemoglobin was 17.1 or 17. I'm not able to exactly recall, but it was slightly higher. So doctor said this is a problem. Like we cannot go ahead with this hemoglobin value. So and actually they had repeated the CBC at the hospital in Delhi, our partner hospital in Delhi. So we were all like, what to do? Then we asked the doctor, is there a way out? And he said, probably during his travel, he might not have consumed enough water or liquid. So that's why his hemoglobin values are high. Ask him to consume the water and take rest for a day. And then we'll repeat his CBC at local lab. Said fine. He went back to his parents' place, and his CBC was repeated, and the hemoglobin came normal. The guy's parents were still worried that like with a single kidney shell, should we allow our child to donate or not? Also, they took opinion from multiple nephrologists at their level, and upon getting the satisfactory answer, Sahaj was allowed to donate his blood stem cells. And when he had met the doctor in Delhi, he met doctor in Delhi around like 21st or 22nd of the month, or December was the month. So he met them over there, and he said, "Sir, can you complete the donation as soon as possible?" I said, "Why? I mean, yes, we want to finish it, but why you want?" He said, "After the donation, I want to go for a trekking." And again, that was a surprise for us, because the guy with a single kidney, he wants to go for trekking, and that too after a donation. Doctor advised him not to go for the trekking. So this guy came in and donated his blood stem cells on 29th of December. And 2 days later, when I called him about to check about his health, he told me that, "Ma'am, I am preparing to go for trekking." I said, "But your doctor advised you not to go." He said, that's okay, but ma'am, I want to go. And he went for a trekking and he came back safely and is doing well. He's completing his studies at uh, one of the universities in Bangalore. So this was one of the very interesting case, and we had to have a blog of this donor. So there's a blog on our website. You can go through and can read his story. So he donated when he was 19 years old. Uh, that's right. Wait, he was really willing to donate. Like, when his parents were worried about, the donation process, uh, and thinking that should we allow our child to donate with a single kidney or not, uh, he was telling the Dathri coordinator, I would say in Hindi, if you can understand, otherwise I'll translate in English later on. But he said, मैम डोनेशन करवा दो, कुछ नहीं होता है, मम्मा पापा तो चिंता करते रहेंगे. Means, he said, please go ahead with my donation, nothing will happen to me, I am strong enough. My parents will definitely worry, will keep worrying, but nothing will happen to me, I am ready to donate. That was his commitment level. So we could make it. Uh, Another interesting case I want to talk to you about a 29-year-old young man. He was also very committed donor, and he was cleared by one of the collection center for the donation. But for some reason, the case was transferred to CMC Ludhiana donation case. So the doctor at CMC said that though the doctor in another collection center had cleared the donor, saying that the donor is physically fit for the donation and all his tests are normal and he can go ahead for the donation process. The doctor at CMC said no. Until we examine the donor physically, we see the donor, we won't go ahead with the donation process. And like usually, we keep doubting the doctors that sometimes in some cases it may be the truth, but like we say that doctors just want to make money and all those things. Some people started talking about this thing, and knowing the doctors at CMC Ludhiana, I knew that was not the case. So I said that no, if doctor has suggested, we will have to take him to the hospital. And the donor also agreed to come to the hospital. Looking at his blood test report, he had hemoglobin of 17.8. So, which was again a challenge. Why such high level of hemoglobin? So, doctors suggested 3 tests to be done. They repeated CBC at CMC. Again, the same hemoglobin level came. So, they asked us to do EPO levels, CBC with film or CBC with smear, and BCR ABL chromosome by fish or BCR ABL fusion by fish. So I would like to share the report. I won't be able to show you the donors like this thing, the name and all, but I would like to show you the report because being from medical lab technology background, you guys should know the report. So this was the report of BCR ABL1 fusion. So it came negative. The test report was negative. CBC film smear test was absolutely normal. EPO levels were normal. But still, the doctor was not convinced. I'm so sorry. So the doctors were not still convinced, and they suggested some further investigation, wherein we got to know that his platelets were bigger in size and they were abnormal. So this donor was not only denied donation, but also was advised to go and see the hematologist in nearby place, or he could have met the hematologist at CMC also, because indicate having the abnormal or the large platelet size is the indication of any in some malignancy. So this was another case. Two same cases, hemoglobin level was high initially, but outcome for both the cases was different. So these are the two interesting cases that I wanted to share with you. The third case, where the donor was from Rajasthan, and the donor was completely illiterate. I mean, he could write his name. That's it, as a sign, as a part of sign. But he was committed to donate. So we did all the tests, and we got to know that his vitamin B blood test was done, his abdominal ultrasound was done, and there were some issues in the abdominal ultrasound report. And by the time the blood test report came, we also noticed that his vitamin B12 and vitamin D was very low. So doctors concluded, because of his vitamin B12 and because this in the CBC evaluation, his platelet count was also low. So that was a concern that with such a low platelet count, donation cannot happen. So the platelet count has to increase for the purpose of donation. So doctors, when they checked the whole blood test report, they got to know that his vitamin B12 level is very low. That's why one of the reason is his platelets are low. There could be a possibility of dengue. So we checked that dengue. So dengue was not there. So the other possibility was low levels of vitamin B12, and that was related to the issues in the abdominal ultrasound also. So doctors advised us that give him vitamin B12 supplements after 4-5 days. Repeat his CBC. We got it done. The platelet count had increased by a substantial amount. So we understood that that was the reason. So based on that report, the donor was cleared, and his platelet count was more than 1,20,000. So it was cleared for the donation, thinking that he will be taking the vitamin B12 supplement for another 10 days before the donation. So fine, perfect. We started his GCSF, and on day 3, when we did his CBC, again his platelet counts dropped from 1,33,000 to 99,000. Again, we were shocked. What's the case? What's the problem? WBC count had although increased, but the platelet counts had dropped. So doctors at CMC suggested that you immediately send this donor to the hospital, and we will admit him. We will give him vitamin B12 injection, and we will monitor his platelet counts. So immediately the donor started travel from Rajasthan and reached to CMC, and his vitamin B12 injection was given. He was kept in the hospital under observation, because upon asking, they said that when we give vitamin B12 injection to any person for the first time, the person may have stomach cramps. So that's why we want to keep him under observation. We said fine, and this injection was given, and doctors suggested that we won't trust the CBC counts, which the report of CBC count that had come through machine. We want to observe the platelet counts manually, or we want to check the platelet counts manually also. So unfortunately, the donor was staying in a very small village place where there was no facility of getting the blood sample on the site. So when the donor came, they checked the platelets manually. It was slightly higher than 99,000, but still was not sufficient for the donation. So vitamin B12 injection was given, and again the test was repeated. still the platelet count had not increased. I mean, it increased, but marginally. So again, doctor said that no, we won't trust this machine reports. We want to check this counts manually. Fine. Again, manual observation was done. The platelet count was higher than what we got in the machine. Again, on day 4, the vitamin B12 injection was given. And on day 5, upon manual observation, the platelet count was 1 lakh, more than 1,33,000. So the donor was cleared for the donation, and donation then started. I asked the reason why there's a discrepancy in machine reports and the manual reports. Then the hematologist assistant explained to me that, you know, when we do the test, it machine, it considers or it counts small platelets. It takes into it takes small platelets for counting the number of platelets, whereas if we do manual, and it skips the large platelets, and the donor had some platelets which were large and some of them were small. So when we did CBC through machine, we had the platelet counts was very low, but upon manual observation it was sufficient for the donation. So donor donated his blood stem cells, and after donation, he went back safely and he's doing absolutely well now. So, I mean, these are the 3 cases which I wanted to discuss with you. Any other questions? If you want to ask me, you can ask me. Otherwise, I can go on talking about the number of cases that I have come across, because we come across so many donors. So, if you have any questions, you can ask me.
Any query, students? Please respond. Students, any doubts?
No, sir.
Okay. First of all, ma'am, I actually now I understood the significance of manual counting, ma'am. Every day I used to tell to my students, and my students used to, there is some complaints in my lab also. They used to say, when we have automatic machines, why we are doing old techniques? Why we are going with, old method of newborn chamber counting, red blood cell counting, white blood cell counting. But obviously, the manual counting plays a vital role in diagnosis. Now, the case study really showed the significance of manual counting, ma'am. Manual methods,
Right.
actually.
Right.
I was surprised. Yeah, ma'am. The significance is too much, actually. Manual counting is
Right.
always a mandatory thing. Yes, ma'am. And this
Correct.
is really important for our students also, where they will be future technologists and future healthcare professionals. Yes, ma'am.
Correct. So
Yes.
definitely, this is one of the important aspects. Like even this was for the first time in our case also. And then
Yes.
we had another donor's case wherein, like on day 3, we collected day 3 CBC blood sample after the GCSF injection was started. So day 3, when we say day 3 CBC sample, that is on day 1 and day 2 we give GCSF injection. Day 3, before administering the GCSF injection, we collect the blood sample and do CBC. So we call this as day 3 CBC. His WBC was about like 33,000. So we were happy that his mobilization is going on well. Day 4, when we did CBC, his WBC count was about 30,000, and we were like all surprised. Why did what was the case? I mean, why did it happen so? So I spoke to the physician's assistant, and he said, "No, ma'am, that's okay. I mean, it happens sometimes that WBC may decrease, but it seems from the count the mobilization is happening, and since the patient's weight is low, we will get the required CD34 count. So don't worry about it." On day 5, again, the CBC count increased by some amount, and after the donation, we could get the required amount of the CD34 cell dose for the patient. So definitely. So like I was talking about the CD34 also. So CD34 count, as probably you would have studied in the earlier sessions, we use it as the measure of, or the that is what the amount of cells being asked by the patient's physicians. Normally, like if the patient's conditioning starts parallelly with the donor's GCSF injection, and immediately once the stem cells are received and they are transfused to the patient, we call it as the direct infusion. And in that case, the cell dose normally asked is about 5 kg million cells per 5 million cells per kg weight of the patient. So, and in case if doctor wants to be, cautious and they don't want to take any chance with the patient, then what they do is they ask the donor to donate, get the cells, cryopreserve them, and then start the patient conditioning, and then they thaw the cells and then they give it to the patient. So during the cryopreservation and thawing, some of the CD34 cells are lost. That is, this count is comes down. So in that case, the thumb rule is normally 8 million cells are being asked. Sometimes doctors ask for little higher dose of CD34 cells. So in that case, they ask for 10 to 12 million cells because they want to preserve the part of CD34 cells, so that if something goes wrong or the graft rejection happens, then the the physician has the extra cells which can be given again to the patient. In that case, they do not have to go back to the donor and request for the leukocyte donations. So, in case like uh, the patients count sometimes even after there is no like graft rejection, sometimes the patient's cell count does not start increasing. In that case, the transplant center doctor asks the donor to do the leukocyte donation. So in that case, which will support the patient until these blood count starts increases at its own. So we do ask that also, but in like 10 to 15% cases, normally doctor asks for the higher dose of the CD34 cells so that we can preserve the part of it. So these are the cases that I wanted to discuss with you. I had also one like we have still little. Okay, before I conclude, I would like to show a video which sir is going to play, who is a very wonderful donor. His name is Abhijit Pundir. He registered at Chandigarh University on 31st October 2018, and he was found to be a match in April 2021, which was the around that was the like beginning of the second wave of COVID. So I was the one who counseled him again, and he agreed to donate. And we asked him that you will have to go to Faridabad for donation. So one of my colleagues from Delhi went there, and she did his physical examination and all. She got done everything, and she got COVID during that time. And at the time of the donation, Faridabad had the highest number of COVID cases. So he said that he won't go to Faridabad. So we called him from Saharanpur, Uttar Pradesh to CMC Ludhiana, and his donation happened on in Ludhiana, and this he donated on 31st May 2021 for a 56-year-old female who was diagnosed with AML. So can you please play the video? So he's sharing his experience about the donation.
Is audio, can you hear, ma'am, audio?
No, I cannot.
Oh, 1 second. I think sharing issues. 1 second.
Yeah.
Sharing sound. This sound sharing has always something. Oh, 1 second.
Yeah, that's right.
Oh, 1 second. And I'm sharing it. There will be an option. Share sound, correct. Now you can, yes, now you can hear everyone. Yes. Is it audible?
Link.
Okay, maybe I will share in the students group, ma'am. I think there is some technical.
Yeah,
Yes,
that's right.
yes, ma'am.
Right, no problem.
Yes, ma'am.
So Abhijit had come with his mother because his father had to go to some other place with his cousin. So his mother came, and not only that, after his donation, I had an opportunity to go and visit his home because we wanted to shoot a video on World Marathoner Day, which is be observed on the third Saturday of September every year. So we wanted to shoot a video